together all your equipment, this airway. Of course, remember we're going to use the ambo bag and your oral or your nasal trumpet, one or the other, okay? This is done. We don't put this in dry, so when you pick your nasal trumpet, make sure you have a water soluble. Don't let it, don't do anything. Just make sure that it comes with a packet that you lubricate this, okay? You come in. All right, so now we checked all our equipment, got everything in place. Now we are ready to proceed. Scene safe BSI. Scene is safe. What's my nature or mechanism of illness? You have a man down. As I approach my patient, do I see any obvious signs of bleeding or any airway difficulty? There's no bleeding, but you got to check the airway once you get to your patient. Okay, come in. There's those signs of trauma. Those signs of trauma. Head tilt, chin lift. As I put my cheek down, I feel for a pulse. I check for 5 to 10 seconds. You have a pulse, but there's no breath. I get my ambo bag. How many rescue breaths do I give them? Two. One goes, did the first breath go in? Yes, it did, okay? Followed by the second. Okay, did those 2 breaths help? No, they didn't. Put the ambo bag down to the side. Choose your airway. I'm going to use the oropharyngeal, lower mouth to here. Fits, cross finger technique. I'm going to insert and twist the airway in place. Great, we got a good fit. Come back. I give my breath. Did this help my patient? Yes, it did. Thank you. And we are breathing once every 5 seconds for the patient. I'll have my partner hook up the O2 to the ambo bag to the tank. Can you ventilate without oxygen hooked up to this bag? Yes, you can. But get it hooked up as soon as you possibly can. So it's hooked up, my partner's hooked up. I'm going to ventilate every 5 seconds. Done.